This is a 59-year-old female presenting with a left breast palpable abnormality, showing you full field CC and NLO views of the left breast. We see our palpable BB marker in the upper inner breast, probably approximately 11 o'clock. On these SM views, we can see some scattered round calcifications, which look typically benign. On the CC view, there's some suggestion of asymmetry here in the more medial breast, potentially corresponding with the palpable marker. And on the MLO view, we see this area here with some potential architectural distortion here in the upper breast, which might correspond to this palpable marker. We switch over to the DBT views. We'll scroll from inferiorly to superiorly first. And as we scroll through, she's got heterogeneously dense tissue, but if we stop about right here, we can see some associated architectural distortion and some potential mass here. Right? There's lots of radiating lines coming in all directions here, going posteriorly, medially, potentially anteriorly here. And this looks like it corresponds directly to the palpable finding. I'm going to scroll back to where we thought this was the worst area. I'll leave that there for a moment. If we look at the MLO view, we can see that as we scroll from lateral to medial, we get to this point here, we can see a large area of architectural distortion and a mass. And we see our radiating lines here going out in almost all directions. And this is clearly a true mass and architectural distortion finding, which warrants further workup with an ultrasound. The patient did go on to have an ultrasound. We see a large area at 11 o'clock, 5 centimeters from the nipple, which is heterogeneously hypoechoic, angular and indistinct margins, maybe a little bit of that hyperechoic halo, posterior shadowing, and some associated vascularity. This corresponds with the finding that we saw on the left breast at 11 o'clock on the mammogram with that area of distortion. And this is highly suspicious for malignancy. If we look at her cine clip from that side, on the left side, right? We can scroll through and you can see some areas that look like there's some potentially radiating lines coming out from this mass. And that's the distortion that we see on the mammogram as well. You can tell on the ultrasound, it's a lot more difficult to appreciate distortion, but it's clearly evident on the mammogram. This was subsequently biopsied and was an invasive lobular carcinoma.